My humble salutations and adorations to the lotus feet of the divinity. Greetings to His Excellency, our President, Cyril Ramaphosa, Premier of the Western Cape, His Excellency Alan Winde, respected ministers of various departments. I brought greetings and support from the Hindu community of the Western Cape and from South Africa. Let me recite the ancient Hindu prayer to seek the blessings of the divinity to bless this gathering, to bless our President and the Premier, all government officials, doctors, nurses, and health workers and staff. Grant them wisdom, knowledge, strength, and courage. Let me seek the blessings of divinity to bless all families, those lost their loved ones. Let's seek the blessings of God and send hope to the families. Those individuals are diagnosed as positive. May God bless and protect you. May you get well soon. And let me recite the ancient prayer 3 times. Hindus globally carry on chanting this prayer for quite a few months now to seek the blessings and for protection. Trayambagam yajamage sukantim pushtivartanam urvarugami bapantanad mrityor mukshiyamamritad. Om Trayambagam yajamage sukantim pushtivartanam urvarugami babhantanad mrityor mukshiyamamritad. Om Trayambagam yajamage sukantim pushtivartanam urvarugami babhantanad mrityor mukshiyamamritad. Om Shanti Shanti Shanti. May Paramatma, the God Almighty, bless this specialized hospital called the Hospital of Hope. May all its operations go off smoothly. May God protect and bless all. Thank you.
I greet you all in the universal greetings in the name of the Almighty Allah. Peace and mercy and blessings on our citizens of our country, on His Excellency, President of the Republic of South Africa, President Ramaphosa, His Excellency, the Premier of our province, Alan Winde, all our ministers and leaders. Bismillahir Rahmanir Rahim. In the name of Almighty Allah, the most merciful, the most gracious. We gather here as humble and true servants of yours in total submission. For everything belongs to you and everything comes from you and everything shall inevitably return to you. As we stand here at this convention center that has hosted hundreds of conventions and conferences and meetings, blessings upon our leadership that have identified this very center to become the hospital of hope for our people and our fellow South Africans. We stand here humbled that, O Allah, forgive us of our sins We stand here as servants of yours, seeking that grant cure to those who are sick with COVID-19 and all other sicknesses and ailments. We seek from you your blessings and mercy and grace, that those in the front line, our medical fraternity, our doctors and nurses and staffs at hospitals, and at whatever level of services rendered to our country, preserve and protect those who are serving the cause of humanity and the well-being of our people. Bless our efforts of the Minister of Health and all the other ministers, as well as our Honorable, His Excellency the President and the Premier, and whatever efforts have been undertaken by relief workers and wherever, let it be accepted by you and a means of goodness to our country. Bless this place, the Hospital of Hope, let it serve its objectives and purposes, and whoever enters here, let them return to their family recovered and well. Change the behavior of our people from one of recklessness and negligence towards responsibility and kindness and compassion to one and all. ربنا تقبل منا إنك أنت السميع العليم. Oh Allah, accept from all of us. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين.
Avinu Shabashamayim, Father in heaven, we gather here today in your presence with humble gratitude for your blessings and a heartfelt prayer for your blessings. We stand together in this magnificent edifice, a building, a convention center of stone, steel, and glass, in the gleaming shine of the world-renowned Cape Town Convention Center, built to host millions of people as we showcase the best of our world has to offer in business, trade, entertainment, the arts and cultures, and so much more. And indeed, we have done so to great acclaim and success. But today we gather here under vastly different circumstances. We have transformed this center of nourishing the self into a home for healing the other. Our exhibit halls are intensive care units. Our restaurants are surgical wards. And our meeting rooms are gathering places for doctors and nurses to help chart the best way forward for those who, God forbid, fall ill and are in need of your mercy. From an icon of self-interest, we hope to become a beacon of serving the greater good. And so we pray. We ask for your blessing and for your children here in Cape Town, in South Africa, and across the world. As the deathly effect of the coronavirus, COVID-19, spreads across the globe, for reasons we can never understand, we stand firm in our duty to you to serve the needy and the vulnerable, and most significantly, those who fall sick and ill. And we need your blessing. It is only by virtue of that we can hope to succeed in our mission. By virtue of that, of my duty as a Kohen to bless the people as you taught us in this week's Parsha, and as a descendant of Abraham, of whom you said, V'hayeh bracha, you shall be a blessing, I offer these words for those assembled here and the countless other beyond these four walls. Yivarechecha Adonai v'yishmerecha. May God bless you and protect you, our President, His Excellency Cyril Ramaphosa, members of Cabinet and national government across this nation, Premier Alan Winde, members of Cabinet and provincial government across the Western Cape. May your efforts on our behalf be guided with God's wisdom and counsel, and may you have the strength necessary to lead us forward. Ya'er Adonai panav elecha v'chuneka. May God show His countenance to you and be gracious to you, our doctors and nurses, medical and paramedical professionals, our first and frontline responders. May you be blessed both in your duty and calling to bring health and healing to others, and may the great risk at which you place yourselves not bring you any pain or suffering, God forbid, and only good health and happiness for you and your loved ones. Yisa Adonai panav elecha v'yasem lecha shalom. May God turn his countenance towards you and show you peace. To you, 57 million brothers and sisters of South Africa, and 7.5 billion fellow citizens of the world, each of us created in the image of you, our God. May the strength of heaven be our anchor in the days ahead, and may we merit to hold each other strong in facing this challenge. With, please God, good health and healing for us all, and through following the way of God and your 7 Noahide laws of faith and respect for God, respect for the life, family, and property of others, even of animals, and establishing systems of justice and equality for all. May we merit to come out of this stronger than ever and behold for once a world perfected and redeemed at peace. Amen.
Allow me to thank the religious fraternity on behalf of our government for your prayers and for your blessings of prayer. Prima Windy, I'm going to hand the meeting to yourself to allow the Mayor of Cape Town to do the official welcoming. Thank you.
Thank you very much, DG, and Your Excellency the President. Thank you very much for you being here along with your cabinet. But before we get into the procedures of today and my welcome, I'm going to hand over directly to the Mayor of the City of Cape Town just to welcome us here to this great city in this great country. Mayor, to you.
Premier, thank you very much. Would you allow me to sit right down here? Thank you. Good morning, Honourable President, Honourable Ministers, all the other Cabinet Ministers that are with us, also members of the Western Cape Cabinet, all the officials, all our religious leaders, the media with us today. Ladies and gentlemen, a warm word of welcome to this facility and also to Cape Town. Mr. President, you acted quickly and you acted decisively to implement the initial 3-week lockdown period in order to allow our health services the necessary time to prepare. As you will see today, we put the necessary measures in place to expand the health services available to the public during this pandemic. Premier Alan Winde and his cabinet and officials have been hard at work preparing our health services and ensuring that the residents across the whole province stay informed about what government is doing to address this pandemic. As the City of Cape Town, we have worked very closely with the Western Cape government as well as with national government to ensure that we're all working together towards the same goal. That is to contain the virus, that is to save lives. As you are very much aware, the lockdown has also caused significant hardship for many in South Africa. And we have to ensure that we also have measures in place to address these hardships. The social response has been an equally critical lever of our response. During the first few weeks of the lockdown, it was clear that the lack of income in many of our communities was going to have a significant impact. We immediately began working with community leaders, the religious community, local NGOs to identify communities most in need in terms of food aid. Once identified, we began equipping soup kitchens in those communities with additional cooking equipment and dry goods to significantly expand their reach. This pandemic has been the greatest challenge to our respective administrations, and the peak is yet to reach us. The medical response, much like the social, requires partnerships between different spheres of government. The CTICC has been an important part of the City of Cape Town's economy through the hosting of major local and international events, as well as some of the world's biggest conferences, and in the process creating thousands of jobs. However, its greatest and most important use appears to be in the next coming weeks. The CTICC 1 building is available until the 27th of July with an option to extend this on a month-to-month basis until the end of this year. The CTICC has generously waived the higher cost of the venue. The temporary infrastructure built, operating and catering costs for the initial hire period will total approximately in excess of 47 million rand. This amount excludes the cost that the Department of Health incurs in providing clinical equipment, oxygen, medication, temporary staff for the temporary hospital. We have done our part as government to prepare for the next phase of the pandemic, even now, especially now at level 3, as we get our economy going again. The responsibility now rests with our citizens to keep following the health regulations. Mr. President, in conclusion, Premier, in conclusion, I want to thank you, Honourable President, for your leadership here in Cape Town, also in the rest of the country. And as one city together, we can beat this pandemic if we all work together. Premier, thank you very much.
Thank you very much, Honourable Mayor. So I'm just going to, first of all, once again, welcome the President. Mr. President, to you and your members of Cabinet, we do appreciate you being here for this meeting, but also for this occasion. I don't really want to single out any specific minister, but I have to say to you, sir, that I think your Minister of Health seems to be spending a lot more time here than in Geneva these days, as I always hear them say that he's in virtual Geneva almost every single day, but he's also here helping us get through this pandemic, and in the words of the Mayor, together. We can only do this together as a common people. And everything that we do is about showing our citizens that we care. Showing our citizens that we are going to do what is necessary to make sure that we get through this pandemic together. So a warm welcome, Mr. President, to you and your ministers. We also want to say to the MECs, I'll say MECs today. In this province, we don't want to cause confusion. Normally we say ministers, but according to our constitution. But I'm going to say MECs today. Thank you very much for being here. Not everyone is here today because we are social distancing, and you will see some of our provincial ministers are also in this meeting online. I also want to say to the generals, to the senior government officials, HODs, DGs, really thank you very much for being here today. I want to welcome the members of the press. But then I want to just spend a bit of time saying to the religious leaders who set the scene today, this is not just a meeting of a provincial and national government while we're in a crisis, while we're dealing with a pandemic. This is also an opening of a facility that I think, as many people have said before me, a really historic moment, because we are turning a facility of culture and trade, an expo, into a health response. And of course, that is what we're going to be dealing with now in this meeting. We're going to be talking about our health response. We're going to be talking about our whole of government and whole of society response, our hotspots, our quarantine and isolation, what our various departments are doing. We're also going to be open and transparent about our risks. I said the Honourable Minister, Dr. Mkhize, spent a lot of time with us visiting, and of course sometimes we have to deal with difficult issues. And I want to say that we might have had some differences of opinions, but I can tell you that our officials worked late into the night so that we could have this meeting today and report what we're going to be reporting today. And so I really want to thank those government officials, those public works officials, those volunteers, and then of course, most definitely, our frontline workers, our health frontline workers, our police and law enforcement frontline workers, people that are out there busy making sure that as a nation we can get through this. I really want to thank them from the bottom of my heart. I honor them with this meeting. And I think the blessing of this facility today was really apt, because this facility is not going to be having a meeting like this again for many months, because it is going to be caring for the people of this province. And so, Mr. President, welcome, and I'm going to go straight over into the presentations so that we, and perhaps just to take this meeting through what will be happening, we will be having the presentation from the government, which highlights those areas that I've spoken to. It speaks about our health response. It speaks about our response on quarantine and isolation. It speaks about our response across the board to the pandemic. But normally, when we have these meetings, it's an extended cabinet where we include 2 and 3 times a week, where we include all of the mayors from the districts. We include our law enforcement and our SAPs and military. It's good to see General Matakata here as a regular reporting into this cabinet on the response from a policing point of view. And we have these, and they're normally 3 hours and more, 2 and 3 times a week. And we're going to try and squeeze this presentation and discussion into an hour. So you'll forgive us, but we've tried to focus on some of the main points, sir, that we can show you what we have been doing, what our response has been, and then, of course, then move into some remarks from the Minister of Health and, of course, then from the President. From there, we will be moving to the official opening of this facility. And again, I ask the members of this meeting to maintain social distancing as we move through. It is very, very important. The new normal that we are all living in is very, very important across our country right now. And then we will have that official opening, and then, of course, the delegations then split, and we will go to see one of the other programs that we have, the Red Dot taxi system for health staff and for quarantine and isolation movement of people. But with those few words, once again, welcome, Mr. President, and I'm going to hand over to the Head of Department of Health, Dr. Keith Cloete. Dr. Cloete, over to you.
Thank you, Premier. Your Excellency, Mr. President, Premier, Ministers from the National Cabinet, the executive members of the Provincial Cabinet, the Mayor, the MACO member from the city, all other officials and colleagues. It gives me, it's a privilege for me to lead this presentation on the Western Cape COVID response, and I will be sharing this platform with Ms. Gooch, who is the Head of Transport and Public Works, and also with the DG of the province. So just a broad outline of what I will be touching on. The first one is just to bring everybody up to speed with the Western Cape COVID health strategy as it stands at this specific point. We will then also give you an update of the health system preparedness, and then very specifically focus our attention on the hotspot strategy, followed by a video, and then hotspot strategy implementation in action, the key challenges and risk, and concluding remarks. So just to start with the strategy and the update, what you see on the screen is what we called our initial provisioning scenario. So in this province, we drew on the expertise of our infectious epidemiologists, infectious diseases epidemiologists, and they from the early days were working with the various groups that were doing the eventual national modeling. And out of those interactions, we worked on a scenario that would take us towards the end of July into a peak with a shortfall of 750 ICU beds and a shortfall of 1,000 acute beds in this province. Since that time, we've had 2,226 admissions in hospitals to date. That is within private and in public sector. 1,984 of that has been only in the city of Cape Town. So 89% of all our hospital admissions have been in the city of Cape Town. 25% of all admissions have been in the private sector. 11% has been in the ICU, of which 45% has been in the private sector. Our ICU mortality to date has been 66%. Our general hospital mortality to date has been 18%. We have established the pattern of a 5-day general ward average length of stay and an 8 to 10-day critical care length of stay. It is a little bit longer than that if you still count in people that is currently in ICU. So we're giving you the data of everybody that has been either deceased or has been discharged. One of the most exciting developments that we have had in this province, because of our big numbers, is the introduction of high-flow oxygen in critical care settings. And we have some very promising results. Out of 114 admissions at Tygerberg Hospital ICU, of which 70% of the people that has been on high-flow oxygen did not need to be on a ventilator. 70% did need to be on a ventilator. And of the cases that was in high-flow oxygen, 70% have recovered. So it's a very exciting development in terms of our shortcome or shortfall in terms of critical care, which I will come to later. So where are we? I apologize, it's a bit of a small slide, but it's really the green bar is our upward trajectory in terms of admissions. The black bar is our upward trajectory in terms of deaths. But if we see what we do in the bottom, is we're tracking it against our original model. So week by week, the tracking of the upward curve is commensurate with what lives in our model. What we have done is we've taken and we've asked to work with, firstly, the Actuarial Society of South Africa, but then with MASHA. MASHA is a group that's based at UCT, and they're part of the National COVID Epi Model group that's advising Minister Mkhize, the MAC, and ultimately the President on what the projection looked like for the country. So they have taken our real hospitalization data, our real death data, and they have validated it against that model. So what they come out with is this is the outcome of that validation. And they are updating the MASHA model for the national purposes based on this update of real data in the Western Cape. And what they find is that our projected peak bed requirement is 7,800 beds, where we previously worked on 6,200. So there is a differential. And this is just a graphic illustration of that. The gray bar is our regional provisioning. The blue line is the peak out of the National Epi model. The orange line is what the Actuarial Society model shows at this point in time, but Minister Mkhize would be aware of this. They are, as the Actuarial Society, also re-looking their modeling. And they are saying if you bring in different modalities, this is an early model for them. They themselves think that's a conservative model, and in all likelihood, it will, if you bring heterogeneity into what happens to the epidemiology of the virus, which means it affects different groups of people in different geographic areas at different rates. If they bring that in, they expect that their ASA model would be lower than what's over there. So the long and short is that our original provision shortfall is then being revised in line with this national COVID epi model. With the revised modeling, we have 989 beds short for critical care, and we now have 2,257 short for acute beds. So the summary of all of that is that both the ASA model and MASHA, using the national COVID epi model, projects higher death rates with an extended peak beyond the end of June, with more deaths and higher bed needs at the peak. And seeing that the national COVID epi model is the official modeling scenario that the National Department will use across the country, the proposal was that we adjust our figures accordingly. And that what we're standing here today, which is CTICC1, which opens 850 beds today, we have as a cabinet then approved earlier in the week an extension of our beds to include 800 additional beds, which is what is called CTICC2, which is the neighboring facility, and we are already in advanced processes of planning of bringing that capacity online after the commissioning of this facility. The second part of the strategy, and we have had major discussions with Minister Mkhize about this and the officials from the National Department, and this is the 4 classic WHO phases that you go through in an epidemic. The first one is when you prepare and you had no cases. The second one is when you stop transmission when you have sporadic cases. The third one is when you start to contain and mitigate when you have clusters of cases. The fourth one is when you move into established community transmission. And with this move between clusters containment and moving to community transmission, we are moving into a process where we are focusing our attentions towards protecting the vulnerable and protecting the health workforce. And we have come up with what we call a risk-stratified case management approach. The basic premise of this is that we have all the cases that becomes known to us. The cases can be stratified into low risk and into high risk. And based on that, our focus then is about finding the people in the high-risk group, protecting them, because the people in the high-risk group are the ones that's more at risk of becoming ill. They're more at risk as the people that would need a facility like the one we're opening today, and they're more at the risk of death. And that's why our risk stratification steps in. This is just a graphic illustration of 1,940 cases we took in a 7-day period to analyze the real positive cases in that 2,000 cases. 2/3 of the cases were under the age of 55 and had no comorbidity. That group of people, in all likelihood, will have a very mild illness, and all of them will recover without needing hospitalization. The other groups, the ones to the left, the people under the age of 55 with comorbidities, and that is hypertension, diabetes, and I will come back to those people are at higher risk of needing hospitalization and therefore at higher risk of landing in an ICU and therefore at higher risk of potentially dying. Together with people that's over the age of 55 as an age group itself, there's a difference between the age of 55 itself, just by being older, even if you don't have comorbidities, makes you more at risk. And the last group, which is the highest risk group, is people over the age of 55 and they have comorbidities. Together, those 3 groups makes up 1/3 of all the cases that was confirmed in one 7-day period in this province. On the basis of that, and this is, I apologize for the busyness of the slide, but this is our death data analyzed. And we take great care in analyzing the causes of death in every recorded COVID death in this province. And if you look at the causes of death in all of those deaths, in the different age groups, you will find the gray bar, that is the highest bar, is the biggest contributor of a cause of death. That is diabetes. That is in the 20 to 39-year-old group, it causes 30% of deaths. In the 40 to 49, it causes 50% of death. In the 50 to 59, it causes 70% of the deaths that we've registered. The yellow bar is hypertension, and you will see between 60 and 69 that hypertension causes more than 70% of the deaths that we've got recorded in this province. And over the age of 70, hypertension causes about 58% of deaths in this specific group. So between hypertension and diabetes, it is the 2 single biggest associated risk factors with severe illness and with death of the documented cases in the Western Cape. We've had some questions earlier in the week about HIV. You'll see HIV is the red bar, and the evidence is not that strong that HIV is as poses as big a risk as hypertension and diabetes. And we have a special group of epidemiologists examining the specific risk in terms of HIV, which we will declare or publish a little bit later when they finish with that specific work. So this, just to show it slightly differently, this is all the deaths. It's 340 deaths. It was done about a week ago. And what you see is that 12% of people at death did not have a known comorbidity known to us. So that's 0. But there's a likelihood that in that group, because of the age group of that group, and we're looking at that 12% in a little bit more detail, that there were comorbidities that were unknown to us at the time of death. So it's likely that even in that 12%, that there were comorbidities, the same comorbidities I spoke to, but it was undiagnosed in that group of people by the time that they died. Then you'll see 23% of people had one of those comorbidities, 25% had 2, 23% had 3, and there's 17% of people that had 4 or more comorbidities. Hence our approach that our risk management or risk stratified management is about people with comorbidities and people over the age of 55 that is the most vulnerable to this epidemic. So in conclusion, in the Cape Metro, there is then the shift towards targeted screening in households and institutions with vulnerable people. What do I mean by that? We have a database of all the people that is hypertensive, diabetic, HIV, have TB, other comorbidities, because we are currently delivering medication to their homes. The idea is to do targeted screening for people in those homes to find the vulnerable people or the people coming into contact with them. The second thing is a shift to a model of self-care for low-risk individuals. And it's not about not caring for low-risk individuals, but it's basically saying we've stratified the population into people that will become iller and the people that's likely to have a milder illness. And the ones that have got milder illness to be able to self-care, stay at home, self-isolate, and look after yourself, with checking in with us. If anything goes wrong, we will assist from that point of view. And then the third one, which I think we spend a bit of time with Minister Mkhize, with Nicholas Crisp, that's here working with us, is the shift to a revised model for isolation and quarantine, which is then based on the protection of vulnerable people in addition to curbing transmission. And it's really finding what does this quarantine and isolation model look like when we are curbing transmission, which we rightfully should do, but in addition to that, we're also looking out and protect vulnerable people. And the last one is then a shift in prioritization of testing policy, with a specific focus on people in hospitals, because as we are speaking, there's more admissions in hospitals, and it's important to actually make a diagnosis in hospital. Secondly, healthcare workers. It is very important. I'll come back to that group of people, because that's the essential people that we have to preserve going into the peak of the epidemic. And then the last one is then the symptomatic high-risk people that I've just given you the description of. So this is an update on the health system preparedness. This is just to provide you what I said earlier in a tabular form. Previously, we worked on 543 need acute bed and 1,261 need for critical care. With the MASHA model, or the national COVID epi model, it moved to 6,300 and 1,500 respectively, with that additional requirement, and that is the figures that I showed you. So for what we've had as provisioning for acute beds, we've had a total of 1,428 additional acute beds, of which the CTIC-1 is 850. There's an additional 600 in addition to that. We have now added the 800 for CTIC-2, which takes us to 2,228, which gives us a shortfall of 29 beds, which we believe should be managed in the platform that we've created. So we believe that that's the provisioning. It's over 2,000 additional beds that must be brought online to be able to manage with to make the system prepared to manage with the ill people that at the peak will need hospitalization. The 989 in terms of critical care is not, we are not able to close that gap mainly from the point of view of the access to critical care staffing. It's not about ventilators, it's not about the high flow oxygen, it is about critical care staffing. to be able to fill that gap. But I'll come back to critical care after that. So our response is the following. And we've taken a platform response. Minister Mbombo is a very big proponent that we look at the entire health platform and strengthen the platform in accordance. So our first starting point is the primary health care starting point. And the primary health care facilities being able to manage larger number of milder cases. And this largely require assessment and triaging for self-management if it's a milder case. And a key consideration would be the fast tracking of clinical assessments of high-risk people who may require hospitalization. So what the primary care facility's role would be is to make sure that people can be assessed quickly. If they can self-manage, they are given advice and they quickly get back to their facility. But if they require hospitalization, they get fast-tracked into the system rapidly. The second one is then testing and triage. We have started, there's a terminology used, fever clinics in the national guidelines. So we've started these testing and triage temporary structures. And it's designed to test and triage in these health facilities in a way that IPC and observing distance like we have in this hall can be done. So that we can make sure that we don't expose people that is negative to people that are positive, to make sure that that testing can happen in that. Then acute hospitalization, which is the big bulk of what we're preparing for. We're bringing online 2,162 beds within the public sector. That is not counting the beds that is in the private sector as well. It is the 2,162 in the public sector, of which is 658 beds are additional beds that we're expanding within existing hospitals. Then on top of that, we bring this 2,228 beds that's being planned. CTIC 1, Brackengate. Minister Mkhize joined us on Monday to visit Brackengate. Tusong Center in Khayelitsha, which Minister Mkhize also opened officially on Monday, which is 68 beds within Khayelitsha. In Cape Wyners, the Sonstraal Hospital, Minister Mkhize was there on Tuesday. And then in Tygerberg Hospital, we're bringing 30 additional beds online. And then, as I said, the 800 beds in CTICC 2. Jackie and I saw the progress that the teams are making with the plans. We're very excited that that process will get underway very quickly. Then critical care, and that's what I mentioned to you earlier. The existing critical care capacity within the public sector is 135 beds. I have to mention to you that at this point in time, we're operating at less than 100 of the 135. And that's mainly due to staffing challenges. So we have the capacity for 135, the physical capacity. We're operating less than 100 in the public sector because of staffing. Our plan is to bring the staffing on board to get to the 135 and to try and get an additional 100, which will be a stretch, and it's all staffing dependent because the infrastructure, the high flow oxygen we will bring online. Then a very critical part of what we want to do in critical care is being able to purchase from the private sector 300 beds for public sector clients to be managed towards the peak. That critical need was registered with Minister Mkhize on Monday because our public sector critical care capacity is already starting to be under strain as we speak. A big rate limiting step potentially would be oxygen supply. And it's the confirmation that this big supply, especially with the innovation that we are very excited about, being able to have high flow oxygen as an alternative to ventilators, oxygen becomes a very critical commodity towards the peak of what we need to do. Then palliative care. Minister Mbombo is a very big proponent of palliative care. We have got an extensive palliative care network in this province, which is not only for end of life. End of life is end of life. But palliative care is when you actually help people through what their life expectancy would be, but is you withdraw active intervention of clinical interventions because the likelihood of success is diminished in terms of the criteria. So it's not withdrawal of treatment. Actually, it's moving to a compassionate process of providing care for people for who active medical intervention might not be the indication. So we are planning 795 beds towards the peak, and 75, which includes 75 standalone palliative care beds and an extensive network of existing palliative care. So the issue here is that 795 will be for COVID-related patients. Our existing network of palliative care will be for all the other non-COVID patients. So that's all the people with cancer, everybody that has got terminal illness. The rest of our platform actually cares for non-COVID. So we're not pushing out in palliative care. COVID is not pushing out the care for people that's got palliative care needs from a non-COVID perspective. The big thing, and you would have noticed, President, and the unions have made some noise in this regard. The big thing is about health worker infections. So we want to make it very clear that we have a daily, up-to-date monitoring and tracking of how many health workers are infected in this province. Our cumulative numbers as of yesterday is 1,662. That is 6.3% of the 26,000 cases that's been confirmed to date. The cumulative number of hospitalizations amongst healthcare workers is 138. That's 8.3% of all the healthcare worker cases. The number of deaths to date has been 15. It is 0.9% of all known health worker cases. So the healthcare worker infections as a percentage of our total staff complement is 4.3%. And that is for our Western Cape government employees, the public sector only. That is spread across hospitals that you would have noticed in the media as Tygerberg Hospital, because Tygerberg Hospital is the biggest single hospital with the biggest number of staff members. It by nature would have the biggest absolute number of infected healthcare workers. It's at this point in time is over 300, but it is out of a staff establishment of more than 3,000 people. And then what we have as comparison to the bottom, which is just what we need to help ourselves to compare. The experience in the USA is that 11% of staff gets infected. That is in spite of the best possible PPE that you can provide. The experience in British Columbia is 21%. The experience in Spain is 19%. The documented experience in China is 3.8%. This is just an illustration of the tools that we use, and this specifically comes from Tygerberg Hospital because it's such a massive place. We have a full-time occupational health specialist whose job it is to look after every single unit in Tygerberg Hospital. Minister Mbombo had a briefing with that specialist yesterday. On the left-hand side is the standard operating procedure we follow for every single case that's positive in Tygerberg Hospital. To the right is the body screening system. At every unit where you enter in Tygerberg Hospital, there's a screening system to make sure that before the person comes into the ward every morning. And to the top is something that we are proud of in this province because we've introduced this as a policy. It's a risk assessment for people that are vulnerable, healthcare workers. Now that risk assessment tool is to assess whether you have a comorbidity as a health worker, to assess your age, and based on that, you can have a score of 1, which means you have no risk as a healthcare worker, you are young, you have no comorbidities, you have relatively no risk, or you can have a score of 16, which means you are older healthcare worker and you have more than 1 or 2 comorbidities. And based on that score, wherever your score is, there's a decision between yourself and your supervisor. Where is it safe for you to work from? And that might be working from home if you're a healthcare worker. But we don't expose individual staff members that have gone through this risk assessment to high-risk areas for exposure in healthcare. And Tygerberg, again, was at the forefront of actually doing the system for the whole province. I'll move to these testing and triage temporary structures. A video will follow, but we have brought this structure online in 20 places already, which was phase 1. Construction has been completed at the Red Cross. The Premier was there recently. Ceres Hospital, that's after the Witzenberg experience. Grootske Hospital, which has been completed in this week, and Mowbray Maternity Hospital. We're starting to construct at Elsie's River CHC. It's the first of phase 2, and we will do 13 additional metro ones and 20 additional rural ones. And these are structures which I said allows for people to be triaged and screened closer as the numbers of cases increase. Our intermediate care facility, the Tusong Center in Khayelitsha, was donated by, it is a city facility, it's a sports center in Khayelitsha. It's right opposite Khayelitsha Hospital. The city has made the facility available, and MSF, Médecins Sans Frontières, has commissioned the place with their own staff, but they work in collaboration with us. That facility was opened by Minister Mkhize, as I said earlier, and they admitted their first patients on Tuesday morning, Minister Mkhize, from Khayelitsha Hospital. 46 patients moved, all fine, all stable, and all being managed. So this is the third day of operation in Khayelitsha. The convention center is the 850 beds that the construction started on the 10th of May. It is completed. We are preparing for our intake of our first patients on Monday morning. So today is the opening, and Monday morning we will start our intake with patients in this facility. Brackengate, Minister Mkhize went with us, is an existing warehouse. The design has been completed. The lease and agency agreements have been approved. The facility can accommodate 330 beds. The pods started taking shape as Minister Mkhize walked through the construction site with us, and they will be released as they are completed. And it's really units where beds will come in similar to what you're going to see in CTIC downstairs. And then the planned first admission is the 7th of July. We are looking at all possible ways of bringing that online quicker, if at all possible, to make sure that we can bring it closer. Sonstra is in Paarl. The first phase, 63 beds, is already coming together now, and the other phases will come online as we speak. That's a fixed facility, and the idea that the investment in that one is that that's investment that will stay afterwards, because we are also planning that afterwards there is acute bed needs in that area, because it's the fastest growing area outside the metro, which is Drakensberg. Then Tygerberg Hospital, we will bring the tent that is in Tygerberg Hospital to 30 additional beds towards the 1st of July. So then, just to go on to the hotspot strategy. The purpose of the hotspot strategy is to reduce transmission for COVID-19. It's to reduce also the morbidity and mortality of vulnerable people in the hotspot areas. The big issue about reducing community transmission is to get people to stay at home unless necessary to leave home, to maintain physical distance when outside home, using a mask at all time outside the house, maintaining hygiene. And then reduce morbidity and mortality is this targeted screening of households and institutions with vulnerable groups, targeted testing for vulnerable people, and then referral to designated quarantine and isolation facilities, active case management of vulnerable people. This is an example of Witzenberg. I want to point you, and I can't, the president in front of you, you can see, in Witzenberg, the table to the right, top table to the right, it tells the story of Witzenberg that we had peaks of cases of 20 new cases per day towards the end of April. What happened was a whole of government and a whole of society intervention in Witzenberg. And that's where the hotspot strategy was put to practice. What you then see to the right of that graph is tailing off to 3 to 4 new cases per day towards the end of May. And that is turning an acceleration of cases around through the intervention of curbing transmission. This is the hotspot map of that area. Anybody familiar with it? It is Ceres, Tulbagh, Woolsley, and outside Ceres there's the town of Ceres, there's an Hunduli township, and there is a Bella Vista township. So the intervention was at all of those. It's a bit difficult to read it at the bottom, but you'll see the cases per each of the areas and what has happened since then. It's what the cases were and what the active cases currently is, which is a huge reduction in each of those areas on the basis of the interventions of the team in that area. The hotspot strategy has specific transversal activities that we're doing. The first one is to mobilize players from all sectors. The messaging is being refined of what exactly we want to achieve in each of those. And then the practical implementation strategies that have started to take shape. My colleague, Ms. Gooch, is going to share those practical things after I've given this input. And then we're using targeted data management to see whether we're impacting in each of those areas with effective coordination of pulling all of these activities together. This is an example of the situation analysis. Minister Mkhize, we're completing these profiles, and we will be sending those profiles per sub-district to tell you what is the demographic socioeconomic profile, what is the population distribution, the density, the vulnerability indices, and when you overlay those, it's not a surprise to see that socioeconomic vulnerability and density of cases coincides in the pockets in these areas. Then it's the trends of the COVID transmission and also hospitalization and deaths in each of those areas. And then the geolocation of the active cases and deaths, old age homes, known cases with comorbidity. And then a very exciting part of this, if you have the GIS and bring all of it together, is to understand the location of the transport hubs, the routes, the schools, the religious sites, the industrial workplaces, because you can then start mapping where all the places of potential transmission would be in that geographic area. What are the hotspots? The national definition, according to the regulations, are very clear. More than 5 active cases per 100,000. This includes the city of Cape Town, Cape Winelands, West Coast, and Overberg. The priority hotspots in the Cape Metro, from Tygerberg, Khayelitsha, Klipfontein, Mitchells Plain, Western, with sub-areas, the Noon plus other areas, and Langa is the other big one in Western. Southern, which is Hout Bay, and other areas, which is Masipumalele and other sides in Southern. And then in Eastern and in Northern. The prioritized rural hotspots is Cape Winelands, of which Witzenberg is one. But there is Drakensberg, there's Stellenbosch, there's Brede Valley. Those are all the ones. And then followed by West Coast, Overberg, and Garden Route. So the health sector response there is the targeted household institutional screening and testing, the referral for isolation and quarantine, the active case management of vulnerable people and processing them very quickly through the system. The quarantine and isolation facility, this is City of Cape Town only. Minister Mkhize, we worked with Dr. Chris up until the evening, late in the evening yesterday with the team locally. So the 6 existing facilities that we have in the City of Cape Town, we are now having accelerated admissions via our sub-district teams into those places. We are bringing 43 new facilities online over the next 2 days, assigned to specific sub-districts, and there's a subdivision of what those facilities are. 4 for Eastern, 6 for Khayelitsha, 3 for Klipfontein, 7 for Mitchells Plain, 3 for Northern, 5 for Southern, 6 for Tygerberg, 9 for Western. And in addition to that, 35 additional facilities will be brought online over the next 21 days. That takes us to a grand total of 9,683. That is the engagement that the team has had, and we're mobilizing to get accelerated admission into these facilities. The hotspot coordination generally, basically as a cabinet, it was agreed that each geographic area in the metro and each district outside the metro will have a member of the executive assigned to it. So it's in line with the district model. But in addition to the member of executive, there's also a designated head of a Western Cape department. We have 13 departments in Western Cape government. Each of those will be assigned to a geographic area with a member of the executive. They will be the key custodians of holding together what we call a multi-sectoral response to the hotspots. A senior municipality official, in this instance, Councillor Badruddin, in the City of Cape Town. We will work with the City of Cape Town in the Cape Metro of who the senior officials are. Then obviously representatives from different sector departments. And then the health manager for that sub-district is a key player in this, because the health manager brings the health response into that, backed up by public health and epidemiology expertise. And then community leaders, civil society representatives with administrative support. The health team has strong public health epidemiology capacity. We've been assigned and designated across the province, family physicians, environmental health practitioners, primary healthcare facility managers and clinical teams, the COPC teams, which is in the drainage areas, in decentralized areas, EMS managers, the NPO nurse managers, community health workers, EPWP volunteers, and the list goes on. But the health team is the mobilized team to actually get into each of the geographic areas. And then the public health epidemiology expertise is specifically there for data analysis support, for technical advice and support, especially on how to use scarce resources for targeted interventions and to map impact. To do research and evidence, there's going to be a lot of research and evidence generated from this, and to support the collaborative learning within and across hotspots. And the capacity will comprise a decentralized allocation of expertise, as I explained, as well as a central supported team. And the latter would do the data analytics support and other forms of transversal support. And the last one that I'm talking to is what is the intelligence we're going to gather? So we are busy putting together what are the indicators, and the active cases per 100,000 over the past 14 days seems to be the most important one that we can zone in on. Admissions and deaths over the last 7 days, the uptake of the risk messaging, and then the number of public spaces where there's visible nudge strategies like hand sanitizers available, markings to enter, physical distancing, mask uptake, all of those are the things that we want to monitor. There is the outstanding issue, Minister Mkhize, about us being able to do surveillance based on serology tests. So the moment that becomes available, we will introduce it into this network of epidemiology intelligence. Thank you very much. At this point, we will view a video. Thank you very much.
Thank you very much. Good morning, Mr. President, Premier, Ministers, MECs, Mr. Mayor, Councillors and colleagues, and I trust all protocol observed. My task is to take us through the hotspot strategy implementation in action as has been presented by Dr. Cloete this morning, and to give a sense that in terms of the approach taken, it's covering a number of themes. Understanding that when we respond from a health point of view with what Dr. Cloete has expressed, that really is captured under the thematic area of case management. Then there's the focus around quarantine and isolation, the aspects in terms of response about civil compliance and our law enforcement teams, fundamentally then the thematic area of slowing the spread, where really everybody comes on board to be able to respond, the humanitarian relief and food security aspects that are vitally important, and then something that I know is also close to everybody's hearts is the aspect of economic recovery. All of those 6 themes are clearly underpinned and interact with the 7th, which is around communication and fundamentally about behavior change. So I'm not going to speak about case management because that's been covered through Dr. Cloete's inputs, and I am going to pick up a little bit on the quarantine and isolation in a broader perspective in terms of the presentation. So facilities have been activated across the Western Cape, not only those that were mentioned within the presentation earlier for quarantine and isolation. As of last night, although the numbers have already shifted slightly this morning, there had been just shy of 2,000 people discharged from the Q&I sites over time, from the point that they had started. And then obviously just over 2,600 people had been placed in Q&I facilities that have been supported by government. There are obviously, in terms of future plans for further beds to be activated, particularly in partnership with the City of Cape Town in terms of resorts that they have available that are going to be brought online and are part of the numbers that Dr. Cloete presented in his earlier part of the presentation. And then over time, and clearly in terms of what was presented there, a further 8,500 beds are immediately available that can be activated by ourselves and others, but are ultimately funding dependent. The Director General will pick up on some of those aspects in his later inputs in the presentation. And then, Mr. President, what we're going to be taking you to see a little bit later on this afternoon is what I believe an incredible partnership put in place between the Western Cape Government and the minibus taxi industry that we've called the Red Dot Transport System. It initially comprised 100 minibus taxis owned by Umanyano, or Unity Travel Services, a company formed by the minibus taxi industry, where those vehicles are used to now transport our healthcare workers when they finish their shift in the evening to keep them safe, as well as then utilize them for transporting people to quarantine and isolation sites. I'll give you a little bit more information about that later on when we see you at our Provincial Traffic College. The aspects around civil compliance, I move on to the next thematic area. This is being done in partnership with the South African Police Force, South African National Defence Force, and all the various agencies that have come together under the Prov Joints. That was established as soon as you declared the state of disaster, and that remains in place functioning to be able to guide this particular part of our interventions across the Western Cape, and obviously specifically focusing on the interventions that are necessary in the hotspots. Integrated policing responses are needed and obviously required, particularly in making sure that we monitor and respond to potential aspects of non-compliance of the COVID regulations. The Prov Joints mandate, it's important that we give you a sense of that in terms of the integrated liaison across all role players under the command of the South African Police Services. That coordination includes the identification of hotspots, the deployments that are required, the actions, activities, as well as the necessary reporting that then comes back through that system. It happens through the various meetings that are conducted weekly on Tuesdays and Thursdays, all parties present, not necessarily only physical, but also obviously virtually present in terms of the meetings that are held. If we move on to what I believe is the fundamental theme around slowing the spread in responding to COVID-19, what I've tried to capture here are some of the graphics in terms of interventions that we've seen practically occurring across various parts of the province and in parts of the hotspots. So in the Western Cape on Monday, schools started to open. You will see these are then pictures taken of our learners observing social distance, being screened in terms of their temperatures being tested, sanitization, etc., and the wonderful interventions taken through the Department of Education and the school governing bodies to achieve that. The Department of Economic Development and Tourism, along with other partners and the Department of Health, have prepared numerous guidelines to help workplaces, different types of companies and organizations get back to work. What do they need to do? How do they need to approach it? What are the various things that they need to consider, even when potentially somebody tests positive? And how do we take care of one another within the various workspaces? Public transport is a key area, obviously, for us. It's a possibility where the virus can spread. So working with the minibus taxi industry, the National Department of Transport, the City of Cape Town, ourselves and others, you'll see the city painting markings for social distancing at public transport interchanges, at the ranks, Golden Arrow bus services, ensuring that their buses are sanitized. We also have put in place through technology an option now for passengers to be able to provide us with feedback if they happen to find that the public transport vehicle that they're in, they haven't been given sanitizer, it's not clean. They can provide us with the details and allow us then to be able to work with the various agencies and entities in order to respond. These are then just some graphics from our City of Cape Town team, sanitizing and cleaning some of the public transport facilities, and then even late at night ensuring that we decontaminate some of those areas. If we continue to the aspect of slowing the spread around PPE and the distribution of personal protective equipment, you can see how the agricultural sector have also come to the party in a whole of government and whole of society response. Through Minister Mayor and his Department of Agriculture, distributing reusable cloth masks to agri-workers, to our farm workers, and subsistence farmers in Witzenberg as one of the hotspots that we've had to respond to. In the workplace and safety compliance within a workplace point of view, the environmental health inspectors from the city, from the Provincial Department of Environmental Affairs and Development Planning, also go out to provide support, to assess what's happening, and to provide some advice in terms of compliance and make sure that people are all working together to slow the spread. Finally, then, within the Dunoon side of things, this is just to give you a sense, working through the Department of Human Settlements and the City of Cape Town, about the de-densification project that is being supported there. The delivery of water to the area, to pockets there in terms of tankers and water that is provided, as well as then increasing the sanitization of toilets, for example, from 3 times a week to 5 days a week in terms of that, to be able to respond to the hygiene requirements from COVID-19. If we move on to the theme of humanitarian relief and food security, from a coordination point of view, there are obviously many people working in this area in terms of the NGOs, the CBOs, our religious groups. So a number of fora have been established in order to help to coordinate that. We've also gone through the process of mapping all of the humanitarian relief that we are able to gather in terms of information and data, and I'll give you a sense of the portal that has been created for that. On the food relief side, we've captured a sense of how many food parcels have been distributed to date. Over 355,000 meals per day are provided across the province as well in order to support people who may be hungry. We've obviously also still been continuing with the feeding scheme at our schools, and over 133,000 learners are fed twice a week at various schools across the province. This is then to give you a sense of the humanitarian relief dashboard that has been created. It is available on the website of the province. So you're able to drill down and get a sense from municipality to municipality how many food parcels have been distributed, what sort of numbers of quantums of meals have also been distributed across the different areas of the province. Finally, then, in mobilizing the whole of society around humanitarian relief and food security, there's also the different sectors that we've been able to access. The Sports Relief Fund, the Artist Relief Fund, and then the other aspect that Dr. Kluti spoke about a little earlier, when you even move into the palliative care side, it's about providing bereavement support where necessary to families and to loved ones. Clearly, our youth is a core part of our response, and so the youth outreach programs are also very important for us in responding. So there are a number of competitions that have been put in place, different challenges and so on, particularly with our youth to get them understanding and responding to COVID-19. On the agricultural sector perspective, just to give you again a sense of some of the hotspots, in Dunoon, 37 food gardens have been implemented, while in Witzenberg, 82 household gardens, and in the Klipfontein region, as a hotspot, 41. And the Department of Agriculture also then goes and makes sure that there's extension advisory services provided to farmers in that area, and they use that as a platform to further create awareness around the responses needed for COVID-19. On the economic recovery side, an example of some of the interventions that have been put in place to date, including the business stakeholder engagements, both through the Economic Development and Tourism Department, as well as the City of Cape Town, interacting with large retailers, putting together impact modeling and various scenarios, and developing the types of recovery plans that are important for us to be able to get the economy moving and stimulated post this epidemic. Finally, from my side, on the communication aspect and behavior change, because all of this is naught without making sure that we change our behaviors as citizens of South Africa through community engagement and awareness. We also make sure that there's research done on a weekly basis to get feedback around interventions, for example, mask wearing, hygiene, sanitizing, etc. There's loud hailing that the City of Cape Town has been doing at transport interchanges to remind people about social distancing and hygiene, posters put up, variable message signs as well, and then even putting out ads in the local community newspapers, mobile billboards also around the area, and even some of the teams putting on posters on the sides of ablution blocks with key messages for us from a hygiene perspective. I'll now hand over to Mr. Harry Malila, the Director General, to conclude through the key challenges and risks. Thank you.
Mr. President, I'm going to deal with the last couple of slides, and if you go back home and you just want to have a summary of what we presented today, the next couple of slides will provide you with what are our challenges and what are our key risks. So we've prioritized our challenges and actually ranked them, and we've got three major challenges, Mr. President, and we'd like you to keep it in the back of your mind when you back home, and also to obviously Minister Mkhize. Firstly, it's the issue around the testing backlogs, which have grown to over 27,000. That was at the end of May. And I mean, this is a matter that we have raised last Monday when Minister Mkhize visited us. There's the issue around the requirements for more gene expert kits, as well as the reagents. There's the issue around the department requiring to improve its own testing capacity and to procure it directly from private labs as well as the universities, and to substantially scale up our capacity. There's the issue around rapid serology test kits, which has been approved by SAPRA, and it should actually be made available to the Western Cape within the next 2 weeks. And then there's the issue around the change in the testing policy, which Dr. Keith Kluther have spoken about, and obviously prioritizing healthcare workers and those that are symptomatic. Then there's also the need, Mr. President, and I'm sure you're aware of this, for consistent national and provincial messaging, particularly around testing. The second issue that's been raised by Dr. Kluther, and there are two slides that will set it out nicely, is the issue around recruiting and the sourcing of additional staff members. Dr. Kluther indicated, all our facilities, what are the staff members and what are our particular requirements, and we believe that we've got a definite shortfall in this space. So within the current intermediate care facilities, the requirement is for 1,306 staff members. I mean, this facility, CTICC, will require an additional 836 staff members. That's obviously when we take CTICC 2 on board, and I mean, I'm sure the Premier have briefed you on that already. Then there's the requirement, particularly within the critical care capacity and within the acute care capacity. Dr. Kluter highlighted those shortfalls. And then obviously the issue that we need to deal with is the increasing rate of infections amongst healthcare workers, and that is increasing across all the various platforms. As a result, Mr. President, we expect an absenteeism rate of about 20% across our entire platform. That's about 4,000 staff members that we will have to get into the system in addition to those that's already employed into the system. And we are able to actually supply about close to 1,500 staff members from the existing available capacity. In fact, 1,477. So the next two slides will actually break it down, but in essence, we require an additional 5,272 additional staff members, but from existing resources. That's why Dr. Kluter also indicated that also that might be a constraint, or actually is a constraint within our current system, and therefore we're going to request, and in fact we've already requested assistance from other provinces to actually assist us in this regard, because we believe that when we on the other side of the peak, that we'd also be able to make some of our services available to our colleagues in some of the other provinces. So, Mr. President, this slide sets out the additional staff needs across the various type of medical specialists. So it's about 2,800 as I've indicated. The next one gives you a summary of how the 5,272 shortfall is made up. You will see, Mr. President, that just over 4,000 within the clinical space, and there's also the additional requirement. But, Mr. President, the biggest challenge that we have at the moment, by far, is the issue around budget security, commitment on the funding. And what we've done, and also it's set out in the letter that the Premier wrote to you, because we believe it's important, you know, that we had to bring that to your attention, as well as Minister Mkhize, that within our current environment, we've already reprioritized existing budgets in all the departments, but particularly within the Department of Health, the Department of Transport and Public Works, as well as in the Department of Education. So just within the space of the Department of Health, close to $500 million, or actually a little bit more than $500 million, has already been made available to actually spend on additional commitments. Within the Transport Department, that amount, the department has already spent about 120 million and have made additional commitments close to 60 million rand in terms of their function that they need to do. Within the education space, close to $500 million has already been spent on PPE, particularly with the opening of schools. And then within the Department of Health, coming back to that space, they've already spent more than 330 million over their normal expenditure projections only in the month of April. And if one actually extrapolate that, Premier, and also, Mr. President, you can think for yourself where that is going to come out. So our projected shortfall at the moment is about 3.5 billion, and that excludes education and what's been spent in some of the other line departments. If we add in education, then that number grows to 4 billion rand. And in fact, Mr. President, that comes in addition to some proposals actually to reprioritize budgets across the country. So we believe it's important that, that you hear our plea.
There's some sound,
at the moment, we are ready. We're already doing what we need to do within the current budgets.
You know what? Turn off the fallback, then I can
effectively run out, and we're not going to be able to move faster if there's no funding security. As I said, we've raised this matter with
I can hear you said,
Minister
how is it
Mkhize,
now?
and he's given us a commitment that he is going to engage the Minister of Finance with regards to this. So as soon as we can get security on the funding commitment that we're going to be supported in this regard, we can actually move forward with much greater speed. And then obviously, Mr. President, the point I made to say that these numbers exclude the cost for other government expenditure. I'm not going to go through this slide in detail, but this slide in essence summarizes the 3.4 billion only in relation to transport and public works as well as in health. And you can see, President, that about 1.2 billion of that only relates to medical accommodation, and then there's also the additional medical staffing requirement which Keith and myself highlighted, and that amount is also just over R1 billion, and then within transport and public works an amount of about 650 million with regards to Q&I, particularly the Q&I beds and other infrastructure related issues. So in conclusion, Mr. President, this is the final slide. This is the take-home notes. What we're doing is we're planning for a scenario, and that's actually been tested with the external modelers, that shows an increase in deaths and also an increase in acute bed needs at the peak. Our HOSA approach has been explained by Jackie Gooch and what we're doing in that regard. But it's not just a whole of society, it's also a whole of government approach that we've demonstrated to you. We're working with all the municipalities, we're working with the city, but we're also working with the broader society. Then there's the issue around the testing policy change and the capacity challenges that's been highlighted by both myself and Keith. There's a major issue around staffing, President, and that's going to peak, particularly over the next 2 months. Then there's the issue around the sorting out the private sector providers, and I believe there's lots of work that's been done in that space. We've also been made aware that there might be a risk around securing oxygen supply, particularly during the crucial and the peak period. And then lastly, President, the most important issue is the issue around budget allocations, the availability of financial resources, the commitment from yourself and from the national departments, particularly from the finance space, that we should actually continue with what we are doing. So we stand ready to do what we need to do, particularly within the Q&R space, but our biggest constraint at the moment is the confirmation on the budget numbers and the budget availability, given the fact that our risk runs around 4 billion. And I mean, if you take our total budget, Mr. President, you will understand why we are very nervous at this stage, particularly around the finances, to execute what we need to do. But the commitment from our side is to do what we need to do, and we want to give you the assurance today that we are ready to implement the strategy to actually stop the spread of COVID and actually return to normality. Premier, Mr. President, that's the presentation from our side. Thank you very much.
Thank you very much, DG, Dr. Malila, and HOD Gooch, and HOD Dr. Kluti for the presentation. Mr. President, normally, as I said earlier, these updates take up to 3 hours, but we've consolidated into just over 1 hour, and you saw presentations on behalf of other ministers and HODs across our government, but in the interest of time, we had to consolidate it. But I thank very much for the presentation. I would also like to say that we have completed our first round of reporting to come back to PCC and the National Command Council. That is a consolidation of all of our minutes, and the DG has already completed that first report to send off to you. So the full detail of all of our meetings from the beginning of this disaster has also been sent off to your officers, sir. I think perhaps my last point before I hand over to Minister Dr. Mkhize is to say that you can see that the DG in this province cut his teeth in Treasury. And it's always good to have someone who comes with that background. And you can see, obviously, it is putting our risks straight up front and center, testing, staffing, and funding. But also we are absolutely dedicated and focused on making sure that we really deal with this pandemic as efficiently as possible. And also understanding that, and I'm going to use the words from Minister Mania, perfection is the enemy. We've got to make sure that we make these decisions and we move very quickly on them. And I think also because this province now through the epidemiology says that we had early seeding, and you can see that our peak is going to be a bit ahead of some of the other provinces, that perhaps that at the end of the day, while it's tough for us because we are right up there in front, with the most infections in our country, that hopefully we can also learn as we go through this process. And just as we need extra resourcing, hopefully we can also help other provinces later on in the pandemic with some of our resourcing. And we definitely commit to that. But could I hand over to Minister Dr. Mkhize? Thank you very much.
Mr. President, if I can just address from here, there was just a few comments which I'd like to just table. Thank you very much. And thanks, President, for your visit, and thanks to the Premier as well for the presentation. I've always been here and been well received, and this presentation indeed does take as much as the Premier has indicated. So I firstly want to say that largely I agree with the presentation. We have gone through quite a lot of issues, and there's a lot of integration of strategies and approaches into the issues that have been raised. Starting with the fact that we have focused on our hotspot strategy, the issue of subdivision of the rest of the districts into sub-districts for more intensive interventions. We have already sent the team of the Cuban specialists to come and assist in the Western Cape, and at this point we have about 28 of them in this province, and in fact I hope somewhere along the line we'll be able to meet some of them. And so that's been part of the support, and there have been other additional reinforcements. Some of the people, Dr. Crisp, that has been quoted, lives here almost. In fact, it does live here now. And then, of course, there's another Dr. Kirikan McCarthy, who works very closely with the teams supporting, particularly on the epidemiology side, as well as the issue of case management and other clinical management issues. The area that we had identified as needing a lot of strengthening in the provincial strategy has been the issue of quarantine and isolation. This is the area that I think we need to really make sure we focus on very strongly to ensure that we can cut the cycle, we can break the cycle of the infection. A lot of discussion has gone into this, and we have seen how various departments have come together, particularly public works, tourism, environment, who have offered additional beds so that we can actually reach the numbers that we need to take the people out to quarantine and isolation. This now adds on to what the provincial government has been doing. They took me around to show me some of the areas where people are going to be taken. I still think that we need more beds. I have said to Minister Delile, Minister Krisi, and Minister Kubai that we need to really push to up to close to 30,000 beds. The focus, the President, has got to be on those who have turned positive in the past 2 weeks. That's where the large source of infection is coming from. So we are not only dealing with the positive cases, we're also dealing with the contacts. And so this is the area where we believe we're going to make a very concerted effort to reach out to breaking the cycle of the infection. Fortunately, there has been a very good test case here in the area of Witzenberg, where we have seen that, in fact, that has worked. Now, this has been also the effect in some of the parts of the country. Bloemfontein or Mangaung was exactly the same. It was a raging epicenter brewing, and we had to deal with it. And the containment, both in Durban and Gauteng, particularly in Joburg, has been really the area of intensive quarantine and isolation of all contacts, tracing the contacts. So there was a gap in the province, and I'm glad to see that it's being now covered. The focus on vulnerable patients that have been seen through is in addition to that strategy. It's a very important one as well, because one of the major factors in the morbidity has been around the additional comorbidities which are associated. The issue of testing, we've discussed it several times at all levels, and I have said that I want to make sure that it becomes a very temporary problem. As the President would be aware, the President has actually opened for us a whole new platform for the whole continent to try to be able to have access to additional test kits, and we believe that we'll be able to make an impact at that level. There's also additional kits that we have just released from customs last night that comes from Russia, from Russia, when we believe that all of this together will actually help us to close the problem of testing. As far as I would be concerned, President, this issue has to be seen as a transitory problem. Although we have tested quite a number of people, the numbers need to be increased. We need to target a bit more and make sure that we don't compromise the case management, and in this case, targeting has to be seen in the context of ensuring that every patient who has to be treated, the results are available despite the fact that there might be backlogs, so that their treatment is not compromised. And all of that, all of us are agreed, and the approach has to be that we will still clear the backlogs nevertheless. The issue of oxygen is again not a Western Cape issue, it's a general country matter, and so the Ministerial Advisory Committee has made certain proposals, and so we are looking at working together with Minister Patel and other ministers to actually approach the relevant industries to deal with that issue. The issue of beds, I'm glad as well that President is here to witness, to actually see some of the beds that have been rolled out, and the numbers of beds are actually quite encouraging. However, we've seen that because of the way the surge has happened, it has moved a bit quicker than what we initially thought. So we thought there was now a shortfall on the beds, but already we have had an agreement with the private sector to assist the province. On Tuesday, we conducted a meeting with the private sector. All the private sector players were in the house, and we then have agreed that the province is free now to actually go and procure those beds. So the 300 beds are a stopgap measure to cover in the event the province needs more beds than our beds are ready, and therefore that covers from that possibility. But we've also gone beyond that point to make sure that there's standardized protocols that has to be followed as we refer the patients, so that we ensure that patients, we as government, public sector, will decide who goes to be referred to the private sector. But we have also made it very clear that the treatment is not going to be different between public and private, and so that area is actually taken care of, President. We will continue to work on it. We've actually said that the province must conclude service level agreements with any institution that they wish to work with, and this is the case in the rest of the country. Of course, the pressure is not the same.
All right, that was Dr. Zweli Mkhize, the Health Minister there, speaking in the Western Cape alongside the President, Cyril Ramaphosa. The Western Cape government has just given a briefing to the Minister and the President about how they're dealing with the COVID-19 situation. The Premier there, Alan Winde, expects that the Western Cape is likely to have about 100,000 infections in that area in the next few weeks. And so we proceed.
Of the 848 deaths, the latest figure, 651 are from the Western Cape. That is 77% of the deaths. So we would be concerned that these numbers will obviously be rising in the next coming weeks in every other province, and the indications are that the numbers are going to be rising, and so we're looking at all of that. Of the tests that have been done, we've done over 820,000 tests, and 23% of the tests have been done in the country are in the Western Cape, and again, we have given more priority to the Western Cape to deal with the fact that there shouldn't be a limitation because of where the epicenter is. So largely, President, I think that we're working closely and tightly on this issue of containment. What I've found to be also quite important is how the multi-sectoral teams have to be, activated everywhere. I was laughing in the Witzenberg area. The presentation was done by Dr. Mayer and went through the whole thing. And I said to myself, this is how the district development model works, where you get someone who is now attached into the district and actually presenting as though he was actually the director of health in that particular area. So I think that in the next few weeks we're likely to see MECs, ministers, mayors, everyone telling us specifically about what the trends are on COVID-19, because you have indicated, President, you'd like all the ministers and the MECs to go and support the community at the local level. So I do want to say, President, I am very much happy that President is here because it also is important for the support of all the health workers in particular, but also for the provincial government. And we do get into quite robust discussion, President, and what we have here are issues where we're quite clear that this is the way to take the fight forward. So, President, I'd like to leave it at that and just say that I am also very grateful for your presence, and also thanks to the Premier for all the support, and of course the whole health team here has worked very hard, and we work as one team. There's only one campaign, it's anti-COVID campaign. This is a South African campaign, it's one country campaign, and therefore it's one Department of Health, and work in that way. Where there are issues, we sit down and try and see how to make sure we support each other. Thank you very much, President.
Thank you very much, Minister Dr. Mkhize. I'm going to go straight over to the President. President, thank you very much. I think, Mr. President, just give us 1 minute. Can I get a technical person to come and have a look at this mic, please?
Thank you. Thank you. Thank you, Premier Alan Winde. Let me take this opportunity to extend my greetings to you and to your MECs, and also to the ministers who have accompanied me on this visit. I'd also like to extend my greetings to the religious leaders who have graced this occasion, and thank them dearly for offering the prayers and the intercessions with the Almighty God for this most important occasion, and we want to thank them for continuing to intercede on behalf of our nation, our people, with our Almighty Being, to enable us to navigate our way around this pandemic. Their continued prayers and presence amongst us is not only a strengthening moment or effort, it is also enabling us to be able to handle this pandemic with determination, and so we thank them, and all of them. I'd like to thank you, Premier, for your leadership. Your leadership has been quite forthright. We've seen how you've, with great determination, been leading our fight against COVID-19 in this province. So we thank you for that. And let me also thank the officials who have been working fervently, from all the health workers who we thank, and many of them have been making sacrifices, life sacrifices. We've lost a number of our health workers in this fight against COVID-19, and they are putting their lives on the line in order to save our lives. And we continue to thank them, and we want to strengthen them and make sure that they are strong enough to continue this fight. I'd like to thank our police as well as our soldiers who are enabling us to manage this pandemic. And of course, we have to thank the media. They have been devoting a great deal of time and effort in spreading information about all the work that is being done in this fight. I'm rather glad that we've got national cabinet ministers who have come down on with this visit. Minister of Police, because Minister Cele has a lot on his hands together with his commissioner here. This is a part of the country where the police have had enormous challenges, and we're glad that he can be here, and he visits this province on an ongoing basis as he does his work. But we're rather glad that he's also here, and the Minister of Public Works and Infrastructure, Minister Delil, also has her job cut out, because we need to be setting up hospitals, field hospitals, and she needs to, and she is giving a lot of support in all this. Minister of Water and Sanitation, Minister Sisulu, I'm glad to hear that water is being made available on an ongoing basis, and that is pleasing. And Minister Creasy, Environmental Affairs, is here, and Western Cape is an area where environmental matters, particularly along our coastline, also is important in the fishing industry. So that is also key. Minister of Transport here in the Western Cape, particularly train transportation, is a major challenge, and I'm glad that Minister Mbalula is here. Other ministers were supposed to be here, but they are also engaged with other matters. Minister of Defense and Military Veterans was meant to be here, as well as Minister of Basic Education. We're rather pleased to have this opportunity to receive this report, and I'd like to congratulate you for presenting such a thorough and well-prepared presentation that has given us a very broad introspective look at what we are doing here in the Western Cape. The Western Cape is the epicenter of COVID-19 infections, and this concerns us deeply as the leadership of the country. And it is for this reason that we felt it necessary to come here, because we need to address this. And I'm glad that your presentation has identified a number of interventions that you've embarked upon. And I'm also glad that Minister of Health, Dr. Mkhize, has spent quite a lot of time here and has been interacting with you on an ongoing basis, and as recently as a few days ago. And we are pleased that Minister Mkhize and his department and all those that he works with are going to remain focused on what needs to be done in this province. Minister Mkhize's work is quite intensive and broad, and he has to be in all places at one go. And as you correctly say, he is our minister who is virtually in Geneva, but has to be in all parts of the country. And we want to thank him for continuing to lead the charge on behalf of our nation and also focus here in the Western Cape. I'm also pleased to see that at the provincial level, the government is working extremely well. You continue to meet regularly. That is very, very pleasing. But I'm also pleased to hear that and to see that you're cooperating well even at national level. There have been suggestions that the Western Cape has always wanted to excise itself outside the broader realm of national government interventions, but you've demonstrated that you are dynamically linked because the Western Cape is part and parcel of South Africa. We are a unitary state, and Western Cape cannot be seen to be charting their own path. And as we face COVID-19, it is very important that that cooperation is at a deep level with the Ministry of Health as well as all other departments in our government. And Premier Windy, I'm really pleased that under your leadership you are ensuring that that cooperation is effective and carries on at a very deep level. I, for myself, I know that we work extremely well together, you and I, and I'm rather glad that the Western Cape can continue doing precisely that. And you at the Western Cape, you've been a leading province in strengthening the district development model. And it is through the district development model that we will be able to have a much more effective management of COVID-19. And if we strengthen that level of working, we will be able to ensure that what we do is most effective and does not lead government to areas of weakness. COVID-19 has also given us an opportunity, which is clearly demonstrated here in the Western Cape, to work with other role players, to work with NGOs, to work with religious, faith-based organizations, and to work with all manner of other entities that have an interest in ensuring that we address COVID-19 properly. I'm glad to hear from your presentation that that is something that you have embraced, and indeed we need to be working together with key role players in our society in everything that we have to do. I have received your letter, and your letter sets out the key challenges that you are facing here in the Western Cape, particularly when it comes to staffing challenges as well as the funding. Let me immediately say, as Dr. Mkhize has said, the staffing challenges must be solved. We are at war. We are fighting a life and death war, and staffing challenges must be solved. We must identify, headhunt, and find all those staff members that we need to bring in Cost is not the issue here. Saving lives is the main issue. And that must also apply here in the Western Cape. When I went to the Eastern Cape, they were running short of a number of health workers they needed to bring on board. We immediately said, together with Dr. Mkhize, that they must go out and find those health workers so that we can manage COVID-19 properly. And similarly, I will say here, not having enough staff members is not going to be an excuse that I will accept. We've got to find them. Money is not going to be the issue. We must pull out all stops to save lives. This is a war that we must win. We cannot sit back and be defeated by COVID-19 on the basis that we didn't have enough staff members. Department of Defense and Military Veterans, Dr. Gulube is here, who is the Secretary of Defense. They are on the ready to bring in defense military personnel who will be able to come to this province immediately to come and lend a hand. And we must also find staff members in various other provinces, and Minister Mkhize will make sure that they are identified and they are brought here. You've alluded to the fact that one of the challenges that you're going to face is beds. Now, I've heard your account in your presentation about the number of beds. I still think that faced with the challenge that we have of greater infections, up to 66 infections in the Western Cape, and having had 77% of the deaths in the country, you will need, and you do need, more beds. We must increase the number of beds. I'm not satisfied with and happy with the limit that you think that you're going to have. We must increase the beds. It's better to over-provide rather than to under-provide, because the worst is still and is yet to come. We therefore must increase the number of beds. This is the one issue that I am not particularly happy with. I would like to see a margin above what you are providing for, so that we are constantly on the ready. When I went to KZN, they had also under-provided the beds that they were going to make available, and at that point we said they need to increase those beds, and they have responded positively, and the beds are now going to be increased. It's all very well to work with models. Models will tell us this and that, and they all work on the basis of probabilities. And I think in terms of our governmental management of this pandemic, we must always be ahead of the curve, over-provide, because if we don't do that, when we have a rush or an increase of people who need beds, we should never be found wanting. In this case, because we are at war, we should never be found wanting. Let us make sure that we pull out all stops and we provide more beds than we may need on the basis of the models that have been built by a variety of people. I'm pleased with the way you are approaching the differentiated strategy where we've identified hotspots. Premier, you earlier told me that the focus that the hotspot strategy that we outlined is now being used for, and a place like Witzenberg is already showing great results. I'm very pleased with that, and I'm pleased that Minister Mkhize had an opportunity to look at that as well. This is precisely what we want to see in all the hotspots, where our interventions and our solutions are focused on each of the hotspots, because it already shows, going by the Witzenberg case, that our hotspot strategy is the correct one, and let us intensify it and begin to apply it in many other areas that are hotspots. Because our task is to continue flattening the curve, and flattening the curve is not a one-day event. It is an ongoing process. It is flattening this curve. We're not going to be able to eliminate this pandemic at one go. It is going to be and stay with us for quite a long time to come. We therefore need to identify areas where there are hotspots, focus on those, and use all the tools that we've got in our toolbox. One of the issues that I did not hear very clearly being articulated here is contact tracing, because it is when we upscale our contact tracing that we will be able to follow through all those who are infected and the contacts and isolate them, quarantine them, and make sure that we are able to flatten the curve on an ongoing basis. And of course, testing has to be upscaled. I know that you've got a backlog of, say, 27,000, but we've got to upscale it. And as Minister Mkhize was saying, we're now going to be able to procure testing kits through this platform that we are launching in a few days for the entire continent, where we will have up to 30 million, well, 60 million for starters, test kits for the entire continent, and where we will have those 30 million test kits being made available every month. And this is a platform that's going to enable our own manufacturers here in South Africa being part of the platform, and a number of other countries on the continent, as well as the offshore ones, be it China, be it Russia, and so forth. We will all be able to buy through this platform. So soon, our challenges when it comes to testing kits is going to be resolved in no time, and we should then be able to continue with our testing. But it's important that the screening campaign that you were showcasing here should continue, particularly through the community health workers who should be spread throughout the province, in the townships, in the various places. They should be spread throughout. One of the ways in which the infections have been spreading also here in the province has been through lack of sufficient social distancing. And as has been reported to me, it's been in shopping centers, in malls, and so forth. We now need to embark, and your presentation raised it, on a massive communication campaign, so that the level of awareness amongst our people should be raised exponentially, so that they become more and more aware of the need for social distancing, wearing of masks, cleaning of hands, and all the protocols that need to be put in place. The same thing should obtain in workplaces, particularly in the farming areas. That needs to be embarked upon. Lastly, you have in your letter alluded to the fact that funding is needed. Yes, funding is needed. We have said that we are going to allocate 20 billion rand to COVID-19, and that is going to work itself through the various budgetary reprioritization processes, but also obtaining the necessary funding from a number of sources. So funding should never be a problem. If it is a problem, it is a momentary problem. We have decided that COVID-19 is a war that we need to fight and win, and therefore we are going to allocate the resources that are necessary. And we note that you need up to 3 billion or so funding will be made available because you are the epicenter of this pandemic here in the Western Cape. So that will be addressed, and I'd like to see that addressed in the bringing in of more staff, putting in place more beds, tightening up on our hotspot strategy, making sure that we implement it to the full so that we get exactly the same results that we are getting at Witzenberg. But all in all, Premier, if we focus on all those areas that, yes, you have identified in your strategy, what Minister Mkhize has also alluded to, and the areas of more beds, more staff that I have raised here, and ensuring that communication is spread as effectively as possible, I am sure we will be able to address this. Now, the last part that I'd like to deal with is obviously at the social level. A number of our people are distressed. There's shortage of food. Many people will have lost their jobs. We do need, at all levels, to come up with an economic response. It does not only rest with the national government, the provincial government must also come up with clear strategies of how we are going to support the various places of employment, companies, to ensure that people do not lose their jobs. But at the social level, we do need to take care of those of our citizens who are facing great difficulties at the social level, where there is hunger, and we need to ensure that it happens at the community level and we are responsive to the needs of our people at community level. And as we distribute food, and I'm glad to see that you've been focusing on distributing food parcels, but also the meals, as we do so right across the board, and we don't politicize the distribution of food, and we make sure that there is no corruption. We do it on the basis of addressing the needs of our people. That is critically important, because that is what needs to be driving precisely how we respond to COVID-19. So I look forward to the further work that needs to be done here. And I'm glad that Minister Mkhize will be spending more and more time coming here. And if there's a need, I'm willing and prepared to come back to see the way you will have moved forward to implement this. I want to see the success of Witzenberg being replicated in Khayelitsha and Overberg and a whole number of other places, so that we come on top of COVID-19 and we flatten this curve. The curve must be flattened. The whole country is focusing on what's happening here in the Western Cape so that they can learn, but at the same time, we need to demonstrate that we can flatten the curve. And it is in our collective hands, all of us, as citizens of our country, but also as leaders in government, as officials, we need to be doing precisely that. And with that, I want to thank you for the presentation and also for showcasing exactly what you're doing. And thank you for the work that continues to be done. May we all keep our hands on deck. The war is not over. This is a long-term war. It will probably take us a year and a half to 2 years living with COVID. And so therefore, we must not lose any stamina. It's a marathon that we are running to deal with COVID. But thank you very much, Premier.
Mr. President, thank you very much, especially for those kind words, but also if I can echo your words of thanks specifically to the front line. It is the front line of this war. where it is our nurses, our police officers who are on that front line. And we really value, and I thank you for the kind words that you have put forward for them. I also want to say that front line is also echoed across our governments. It is not just our politicians, but it is our government officials who in this time are putting in many more hours than they've ever done before. I'm sure, Mr. President, you noticed those 3 o'clock in the morning phone calls and those 11 o'clock at night Teams meetings, and even the teams getting together before today, running late into the night, and that is happening 7 days a week. And so I really want to echo your thanks to all the frontline, and I want to join to say thank you very much. And it is still a marathon. We are at the beginning. We've got a long way to go. You said it's a war. You mentioned the province, the epicenter, and of course epicenters can change, or can I say the front line. And of course in a war, that front line, and thank you very much for the resources that you're talking about, and also your oversight and saying, you know, you want to help us with extra beds or make sure we get the funding right. It is to make sure that that front line is resourced in this war. And of course, that is going to be an ever-changing front line over the months to come. We see our colleagues in other provinces also starting to deal with numbers that we were dealing with a while ago. And we've got to help each other. As you say, we've got to do this together. And so can I really thank you for bringing your ministers, for pledging your support, and specifically those ministers that over the last few months have been also in that front line in this war, making sure that we are dealing with it. I hear what you say about the extra beds, the contact tracing, the Q&I, and we're responding to those issues, and we will respond to the maximum. And thank you very much for the commitment on test kits, etc., so that we actually together find out we've got to raise these issues when we pick them up, and then we've got to deal with them decisively. That's the only way that you do win a war. Thank you very much also for recognition of the work that's happening across our governments. And I think you ended off with talking about our behavioral change that we need to put in place. This region knows behavioral change because everyone still has a bucket in their shower. And so, again, we have to make sure that our golden rules become the norm. It becomes how we lead our lives, especially over the next while trying to keep the curve as flat as possible. And so, again, we need to plead to every single person in this province to bring that behavioral change into their lives, make sure that they are washing their hands regularly, that they are hand sanitizing, and specifically wearing their masks and keeping social distance. And Mr. President, then your point about the economic or the socio-economic responsibility that we are going to have now, not to waste a crisis like this, but to make sure that we turn it into an opportunity. We already see the number of people who are put under tremendous pressure, and we really are going to be working day and night, not only to fight the war on this front, but also to make sure that we create opportunity for the future. And perhaps also what you're saying about, we talk about test kits and importing them, but we also have a health tech and a health innovation system and entrepreneurs in our country that are second to none. And of course, if we can give them the opportunity, not only for us here in our country, but also for the continent and the world. So thank you very much once again. If I can say to everybody here, thank you for being here as part of this cabinet. And we are now going to be moving to the opening, official opening ceremony of this health response as a hospital. I probably don't need to remind you because the President has said it, but I'll say it again, social distancing when we move. This is leadership here, and we have to show the country that we are adhering to it. And of course, I also have on my right-hand side Minister Mbombo, who will come down on us like a ton of bricks if we are not social distancing, correct? Yes, as she does. So please, we are going to end this. Mr. President, you and I will leave. Then we'll allow everyone the opportunity to move down for that opening. And then that will be the culmination of this process before we have some lunch. But thank you once again, Mr. President, and your team. Greatly appreciated.
Colleagues, I'm going to ask you
to go and check the Western Cape's response to the COVID-19 pandemic. Of course, that particular province is currently the epicenter of the coronavirus pandemic as we speak. The Western Cape delivered a briefing to the President and his cabinet ministers, just showing what their response is. And the President responded, but basically saying that they need to do more in terms of getting more beds and of course also getting more staff as well, saying that cost at the moment is not an issue, saving lives is, and also promising that indeed budgets will be made available to the Western Cape and of course the rest of the country. The government has put aside 20 billion rand towards fighting COVID-19. Well, we're going to go for now. We'll have more news for you at the top of the hour. Hopefully my colleague Arabile Gumede will be delivering the news to you at the top of the hour. Do have a wonderful weekend.